of question time in the National Assembly. COPE's Alfred Khanare had a concern about the proposed national health insurance system. He wanted to know from the Minister of Health, Dr. Aaron Motsoaledi, whether the NHI had developed mechanisms to deal with the failure of provincial departments to spend funds earmarked for vital infrastructure and healthcare improvement. Dr. Motsoaledi said the improvement of performance by provincial health departments to spend funds did not rely entirely on the implementation of the national health insurance. He said the national and provincial health departments had already been implementing a number of programs and initiatives to spend funds earmarked for vital infrastructure and health care improvement.
The Department of Health is already implementing a number of concurrent interventions to improve spending on health infrastructure. These interventions include the establishment of dedicated project management support unit to focus on effectively managing the spending and performance of the hospital revitalization and health infrastructure conditional grants. The interventions that have already borne fruit in this area include coordinated monitoring and proactive interventions in collaboration with the provinces through specific service level agreements and business plans. As a result, Honorable Speaker, spending on the infrastructure conditional grants is definitely improving. With regards to the healthcare improvement, funding has been allocated as part of the equitable share to provinces. Work is underway with regards to the finalization of the health facility audit and the determination of interventions that will be implemented for healthcare improvement and the overall management and functioning of health facilities. To this end, health facility improvement teams have been established to focus on improvement of facilities and will put mechanisms in place to improve quality of care and health outcomes within identified districts. Under the NHI, it is envisaged that the improvement of health care will be achieved through various interventions, including the accreditation of providers according to criteria set out by the Office of Health Standard Compliance.
Mr. Alfred Khanare then wanted to know how people in these health institutions could be expected to spend on infrastructure development when they could not even spend on basic medical needs like keeping hospitals clean and stocked with medicines.
Infrastructure is going to play a very important role as far as the rollout of the national health insurance. And in the light of the Auditor General's report on the infrastructure, that the provinces were faring very bad as far as the expenditure is concerned. And together with the research which has been released by the Health Systems Trust, which found that the necessary intervention is required in about 4 district municipalities of Motheo in the Free State, Sidibeng in Gauteng, Zululand in KwaZulu-Natal, and Pixley Kasem in Northern Cape, where they found that in Motheo alone, in the Free State, 77% failed in terms of cleanliness, 64% failed on availability of medicine supply, and 60% failed on improved patient safety. And Sidibeng in Gauteng, 79% failure in cleanliness, 58% failed in terms of medicine supply, etc. The issue here is that if these people, the people employed in these institutions are unable to do the basic things which they are employed for, how do we expect them to implement the infrastructure, especially because all of us knows that the public works is a mess?
I need to inform the honorables member that the report is talking about was commissioned by me. It's not a coincidental report. We are the ones who commissioned a report on facility audit, and I'm the one who released those results in a press conference publicly about cleanliness, safety and security of staff, drug stock outs, the long queues, infection control. That's our own report. So what you are quoting comes from us, by the way. And the districts that we have identified, Motheo, Sidibeng, Zululand, and Pixley Kasem, is where the facility improvement teams are going to start. We just chose these districts as a starting point to improve the issues we are talking about. That is the first thing I want to say. The second thing about infrastructure, we are also painfully aware of the weaknesses of infrastructure delivery especially within the Department of Public Works. The Minister has said that publicly. And I've just informed you about the steps that we are taking, including hiring engineers within the Department of Health to form these task teams. And I'm informing you that since that has happened, there is definitely visible improvement.
And that's where we have to leave it. We have run out of time. Enjoy the rest of your day, and until we meet again, goodbye.